I've been in practice since 1978, and lots of people have questioned me over the year what really is chiropractic healthcare. And I'm going to give you some information now, and in the future videos you're going to get more. But I'm going to try to make it as easy as possible to understand it. But I have a question for you. What is the difference between sick care and health wellness care? Now think about that. Should you only get care when you're sick? Or wouldn't it be better to prevent sickness? And right now I'm hoping you're saying, yeah, prevent sickness. There's an old saying, an ounce of prevention is worth a pound of cure. Yes, seeing a doctor when you're sick always costs more than doing the things necessary to stay healthy. Think about just being in a hospital, what the bills would be. I always use this analogy. Do you wait until your fuel tank is empty on your car? Or do you keep fuel in it to stop that from happening? I always hope you have more than enough fuel to get where you want. In fact, I always told my children, what if you were driving and had to take a longer route because the normal route that you take was closed? You're going to need more fuel, won't you? And I can think of so many other reasons why should you to have more than what you need. And by the way, my children never ran out of fuel, which made it lucky for me, so I didn't have to find it in the middle of the night. So what can be done to help you get the best possible chance to prevent or lessen a sickness? There are so many good and easy things to do. And that's my job. In fact, I do it to myself. And I have patients who look at me when I'm shopping, my shopping wagon, and notice all the good things in there. In fact, a patient just the other day stopped me and said, "You really do walk the talk." And of course I just smiled. Yes, I do what I preach. These things that I do work. Not only have I tried it, my family does it, some of you, my patients, do it, and of course doctors, like myself, do it and then tell their patients too. If you go and look at my website, you'll see all the wonderful life-changing stories my patients have written. And I'm so grateful for those, and even more grateful to have this knowledge that took me many years, lots of time away from my family, and lots of money to learn. As I'm talking, I'm thinking about a story. It was a man in his late 60s, and that's where I am. I'm in my late 60s now. And Mr. Kennedy worked a very hard life. He had a leg that almost didn't work. Yeah, it dragged. He could hardly do anything. A friend of his referred him to me. In fact, they brought him to my office. Now, he had been from doctor to doctor for years. It was only getting worse. See, they were just treating his symptom. They weren't looking for the reason why. After I examined him, I knew I could help him, but didn't know how long it was going to take. I did what I had to do that first day, and when he got up from the table, he felt some better. Nothing exciting, nothing, like night and day, but he just felt different. Now, I explained to him what he had to do at home and when he needed to return. And guess what? He did. He never missed a visit or missed taking any of his supplements. It took him 3 months, but Mr. Kennedy could walk upstairs and play outside with his grandchildren. He and his family were so grateful that they convinced a local radio station to have me do a call-in show. Yeah, people called in from all over asking questions because they needed help too. You see, we've all been given sick care, waiting until we break down before we are helped. Now, I think differently. And the reason is because of my uncles. They were house builders and automobile mechanics. They told me, maintain your heat and air conditioning, make sure your drains are clean, don't overload the electrical outlets, change your car's oil and brakes, etc. And I can still hear them saying that to me today. And I'm so grateful for patients like Mr. Kennedy. They didn't give up on hope. And then they told their friends how they got helped. They knew there was someone who could do what others didn't, and they would get well. In the next few months, I will exposing you to new and exciting ways to get well and stay well. I've been doing a lot more studying and training for this. Some of you I've already told, and I'm just so excited with all of this. But I want to reverse the present horrible health statistics. I hope you'll listen and not only feel a difference, but can tell others of your difference. I want to thank you, and I hope to see you soon.